सकारात्मक सोच को आओ सारे भारत में फैलाए, सकारात्मक ऊर्जा का आओ सब में संचार कराए।
श्रीमद् भगवद गीता भारत का गौरव ग्रंथ है, लेकिन केवल भारत के लिए नहीं, समूचे विश्व के लिए। हिंदुओं की आस्था, लेकिन समूची मानवता की प्रेरणा। भगवद गीता वर्तमान की प्रासंगिकता है, वर्तमान की आवश्यकता है, बच्चों का संस्कार है। भगवद गीता युवाओं में सकारात्मक रचनात्मक चेतना का संचार है। गीता वास्तव में मानवता का श्रृंगार है। भगवद गीता की प्रेरणाएं जन जन तक पहुंचे। इसलिए गीता ने एक आह्वान लिया गीता जयंती के दिन, जब गीता उपदेश हुआ, जहाँ से गीता उपदेश हुआ वहाँ से लेकर के पूरे विश्व तक के लिए जो जहाँ है, 1 मिनट एक साथ गीता पाठ। और ध्येय वाक्य है उसका, हम एक बने, हम नेक बने। इस लक्ष्य के साथ आओ जुड़ें गीता से, आओ जोड़ें गीता से, बढ़े सद्भावना में वातावरण की ओर, बढ़े मुस्कुराती मानवता की ओर। 1 मिनट एक साथ गीता पाठ, 23 दिसंबर गीता जयंती, प्रातः 11 बजे।
हमारे बीच में जो पॉजिटिव इंडिया से जुड़े हुए उदय कुमार मन्ना जी भी हैं, वो भी अपनी बात रखेंगे संक्षेप में।
वंदे मातरम ये शब्द आजादी से पहले आया, आज हमें अपने सभी बच्चों तक ये पहुंचाना है। स्वामी जी, पॉजिटिव मीडिया, पॉजिटिव भारत दैट इज इंडिया। पहले हम लोग पॉजिटिव मीडिया, पॉजिटिव इंडिया करते थे, लेकिन जब से ये भारत शब्द आया, वैसे हिंदी में सकारात्मक पत्रकारिता से सकारात्मक भारत निर्माण 9 साल तक लगातार, ये भारत में अपने आप में एक आजादी का अमृत महोत्सव की एक ऐसी जन भागीदारी है। स्वामी जी, 190 कार्यक्रम करने के बाद हम लोग सोच रहे थे कि हम लोग अपने हर रविवार RJS वेबिनार, राम जानकी संस्थान का RJS वेबिनार होता है, हम लोग सोच रहे थे, ढूंढ रहे थे। वेद प्रकाश टंडन जी जो शिक्षा ही नहीं संस्कार देने का काम कर रहे हैं, मैं इनसे जुड़ गया। आज इस संकल्प में सुझाव नहीं है, संकल्प लेना है। स्वामी जी, हम लोगों का कार्यक्रम हर रविवार होता है 11 बजे से 12:30 बजे। 190 कार्यक्रम हुआ है, यानी 1.5 से 2 घंटा समय देश के लिए। राष्ट्र प्रथम, भारत एक परिवार, विश्व एक घर। इसीलिए इन्होंने सभी बंधनों को तोड़कर राष्ट्र प्रथम के लिए आह्वान किया है। RJS की तरफ से मैं घोषणा करता हूं कि हम लोगों का हर रविवार जो कार्यक्रम होगा वो गीता के श्लोक से शुरू होगा, और ये 2047 तक का संकल्प है। हर रविवार RJS वेबिनार। जी, जय हिंद।
बहुत बहुत धन्यवाद आपका संकल्प सार्थक हो, सफल हो।
जय हिंद आप सभी लोगों को। और आप लोगों ने देखा कि हम लोग 2047 तक जो अभियान चला रहे हैं वो इतिहास में दर्ज नहीं होने का कोई प्रश्न नहीं उठता है। हमारे अंदर सकारात्मक ऊर्जा पूरे देश भर में फैलाने के लिए कई राज्यों की यात्राएं ऑलरेडी 9 सालों में हो चुकी हैं, और अब हम लोगों के जो ध्येय वाक्य है वो है सकारात्मक भारत उदय आंदोलन। और इसे लेकर अगर आप आत्मसात करते हैं, सकारात्मक पत्रकारिता को हम लोगों ने इसमें इन्वॉल्व किया है, जिससे कि सब अलग अलग विषयों पर करने जा रहे हैं। आज हम लोग द पेशेंट सेफ्टी एंड एक्सेस इनिशिएटिव इंडिया फाउंडेशन के सहयोग से, प्रफुल्ल भाई आज के को-ऑर्गेनाइजर हैं, और पैनलिस्ट भी आप देख रहे हैं बैनर में। सभी लोग विश्व मानवाधिकार दिवस पर, आज विश्व मानवाधिकार दिवस पर हर रविवार जो वेबिनार होता है, तो आज विश्व मानवाधिकार दिवस पर यह घोषणा की गई है कि हम लोग हर रविवार गीता पाठ से कार्यक्रम का शुभारंभ करेंगे और विश्व में गीता के संदेश को ले जाने का प्रयास करेंगे, क्योंकि विश्व को गीता की बहुत जरूरत है। द अवेयर कंज्यूमर का जो टॉपिक होता है हर महीने का, तो उस पर ही आधारित हर महीने एक रविवार 11 बजे से प्रोग्राम होता है। कंज्यूमर सेंट्रिक फार्मेसी प्रैक्टिस, ये नेशनल कंज्यूमर डे के अवसर पर द अवेयर कंज्यूमर का जो मैगजीन है, इस पर आधारित आज डिस्कशन करने के लिए तमाम देश से जुड़े हुए लोग, आरजेशियंस और अन्य तमाम लोग यहां जुड़े हैं। जागो ग्राहक जागो, हम लोग आज जगाने का प्रयास करेंगे और इसके लिए आज के को-ऑर्गेनाइजर प्रफुल्ल भाई को आमंत्रित करेंगे, जो कि वाइस चेयरमैन है पेशेंट सेफ्टी एंड एक्सेस इनिशिएटिव ऑफ इंडिया फाउंडेशन के। स्वागत है सर प्रफुल्ल भाई।
मन्ना जी, थैंक यू वेरी मच। जय हिंद, वंदे मातरम। हमारे संयोजक श्री उदय मन्ना जी का आभार। Let me extend a warm welcome to all the participants on behalf of the Ram Janki Sansthan and Ram Janki Sansthan Public Broadcasting House. I also thank Patient Safety and Access Initiative of India Foundation for sponsoring this program. The theme of today's webinar is Evolving Consumer-Centric Pharmacy Practices. Today is Sunday, 10th December 2023. Today we also celebrate Universal Declaration of Human Rights for dignity, freedom, and justice for all citizens. The National Consumer Day 2023 actually falls on 24th of December 2023. However, as we would be celebrating Christmas on 25th, we thought it would be a good idea to prepone the consumer-centric webinar. Let me briefly mention how topic was chosen. In the editorial board meeting of the Aware Consumer magazine for the December issue, our senior board member, Mrs. Beena Jain, Beena ji aaj upasthit hai, had raised serious concern about the presence of substandard and spurious medicines available in the drug outlets. Before we get into the consumer-centric pharmacy practice, हम देखेंगे कि प्रेजेंट सिनेरियो कंट्री का क्या है ऑफ एक्सेस एंड सेफ क्वालिटी मेडिसिन्स के लिए। एक CDSCO ने रिपोर्ट हर महीने जो पब्लिश होता है ईच मंथ, हमें पता लगता है कि 4 से 7%, 4 to 7% of drugs are found to be substandard in our country. These drugs are sold in the market and consumers consumed by the patients. We can very well imagine the fate of patients with these drugs having no effect, less effect, or adverse reactions. Also, the unabated menace of spurious medical products continue in the market. Our market size, as you know, is 2 lakh crores, which is growing at 8 to 10%. And so the extent of substandard and not of and spurious medicines must also be progressing accordingly. We are going to talk about the good pharmacy practice which is facilitating the therapeutic outcomes for medicine. जैसे हम लोग ने देखा है कि सप्लाई चेन में गुड मैन्युफैक्चरिंग प्रैक्टिसेस होती है, गुड डिस्पेंसिंग प्रैक्टिसेस होती है, वैसे गुड फार्मेसी प्रैक्टिसेस भी होती है। और ये तीनों और भी उसके सहयोगी जो है, जैसे क्वालिटी है, तो अगर कोई बाधा आ जाती है उसमें से किसी एक पर भी, तो ये उसका परिणाम होता है कि ये सबस्टैंडर्ड मेडिसिन हो सकती है। और जब इंटेंशनली इसको किया जाता है तो स्पूरियस भी हो सकती है। दुनिया के काफी देशों ने अपने देश में एक स्टैट्यूट लागू किया है जो कॉम्प्रिहेंसिवली किया है ऑन गुड फार्मेसी प्रैक्टिसेस। आज हम गुड फार्मेसी प्रैक्टिसेस की बात करेंगे कि ये कैसे एक अभिन्न अंग है कि जो हमारी दवाइयों की गारंटी कंज्यूमर्स को दे सकते हैं। कंज्यूमर का तो एक ही मकसद है, वो बेचारा पैसा देके दवाई खरीदता है और उसका तो एक ही मकसद है कि जब मार्केट में जाए तो उसको क्वालिटी की मेडिसिन मिले जो इफेक्टिव हो और जिसमें कोई सबस्टैंडर्ड या तो स्पूरियस एलिमेंट ना हो। इसीलिए ये स्कोप ऑफ फार्मेसी जो है उसमें रिस्पॉन्सिबिलिटी ऑफ फार्मासिस्ट काफी बढ़ जाती है, क्योंकि इसका जो प्रयोग है वो काफी ट्रेडिंग में नहीं है। जो हमारे देश में एक 10 लाख फार्मेसीज चलती है, वी आर ग्रेटफुल टू देम, बट जो ट्रेडिंग का रोल सामने आ रहा है, इट गोज बियॉन्ड दैट। इसके अंदर काफी और चीजें भी फार्मासिस्ट करते हैं, और उस क्या क्या चीजें करते हैं और क्या अपना रोल को एक्सपैंड करना चाहिए, कैसे प्रीमाइसिस होनी चाहिए, कैसे लेजिस्लेशन होना चाहिए, कैसे डॉक्यूमेंटेशन होना चाहिए, ये सारा गुड फार्मेसी प्रैक्टिस में दिया जाता है। अब इससे ज्यादा बात करने से पहले मैं आपको ये बता दूं कि इट इज पॉसिबल, एंड इंडियन फार्मास्यूटिकल एसोसिएशन, दिल्ली फार्मेसी ट्रस्ट, ये लोगों ने काफी मेहनत करी है कि जिससे ये गुड फार्मेसी प्रैक्टिसेस, गुड स्टोरेज प्रैक्टिसेस वगैरह का हम लेजिस्लेशन ला सके। लेकिन हम अब तक सफल नहीं हुए हैं कि जिसमें कॉम्प्रिहेंसिव लेजिस्लेशन हम ला पाए। तो एक आज का जो प्रोग्राम है वो एक और एफर्ट होगा हमारा इस दिशा में जाने के लिए, और मैं बहुत ही आभारी हूं आप सबके कि आप सब आए हैं और आप इसमें साथ ले रहे हैं। मुथैया जी तो यूएसए से भी जुड़ गए हैं। मुथैया जी का टाइम जो है वो क्या टाइम होगा सर अभी? आप म्यूटेड है सर, आप म्यूटेड है सर, आप म्यूटेड है।
Okay. Can you hear me now?
Yes, yes, yes.
Okay. Yes, it is close to midnight.
You are so punctual. You joined before anybody else joined, sir. We salute you.
Very good.
We have two very eminent speakers today with us, because when we look around, we thought that these are the people, because they're connected with the profession, both on the ground and with the students. So we thought that they would be able to give us a fairly good idea of how we should be proceeding. So first, Shri RAJ Vaidya, you can see him on the screen. You know, he's a second generation pharmacist in the sense that he operates a pharmacy which was set up by his father, if I'm not wrong. And his pharmacy is by the name of Hindu Pharmacy. It is situated in Goa. It is not the traditional 200 feet pharmacy, square feet pharmacy. It is fairly large. And he does a lot of other things in his pharmacy besides just trading. He will tell us about it a little more. So he is a practicing pharmacist, and he will be delivering his keynote address and explain the concepts. He has been the author of this good pharmacy practice concept, which he had produced for the Government of India, for Ministry of Health and CDSCO. He has also, to his credit, an accreditation system for pharmacy, which he had done a number of years ago, and he had tried to accredit pharmacies also, but I think except one, no other pharmacy could qualify. So the need was felt long ago, and they have been doing silently their work. I think we need to be heard. Raj will deliver his keynote address. And our second guest is Professor Manjiri Gharat. She is Vice President of the International Pharmaceutical Federation and also Principal of the KM Kundnani College of Pharmacy and Institute of Chemical Technology in Thane. She will share her expert views on international best practices in pharmacy and what the country needs to do to assure consumer-centric good pharmacy practices. So I thank you all once again, and I now hand over the proceedings to my good friend, Professor Bijon Kumar Misra. He is an international policy expert, as you know, and he is a familiar face on all our Sunday programs. In fact, unless he does one or two puns on Sunday program, अभी आज किसका करेंगे वो पता नहीं है मुझे, लेकिन बिजॉन दा, thank you very much. Vande Mataram.
Thank you. Thank you, Prafull Bhai. Thank you very much. And गुड मॉर्निंग टू ऑल माय फ्रेंड्स जो लोग समय निकालकर संडे को 11 बजे उपस्थित हुए हैं और अपना समय दे रहे हैं। हम बहुत ही आभारी हैं कि आप लोग सब जुड़े हैं। स्पेशली माय प्रोफेसर फ्रेंड रमैया जी फ्रॉम यूएसए। रमैया जी, इट्स ऑलवेज एनर्जाइजिंग टू मीट यू एट मिडनाइट and you so with a smiling face and before time join us, that it actually motivates us that this is why we continue. You see, this meeting on Sunday 11 o'clock हमारे लिए एक बहाना है सुदीप जी से मिलने के लिए, उदय मन्ना जी से मिलने के लिए। एक बहाना है। हम लोग इसलिए मिलते हैं क्योंकि हफ्ता भर हम लोग बड़े व्यस्त रहते हैं। We are all very busy throughout the week. So sometime we all as friends should meet and relax and enjoy and exchange notes in terms of हम लोग क्या किए हैं, हफ्ता भर में क्या किए हैं, हम लोग समाज को क्या वापस दिए हैं। क्योंकि we are all deriving a lot of strength from the community. We are deriving our livelihood from the community. We are deriving our, competency, intellectual capacity from the community. So we must all agree to contribute something back to the community. And this is what, my message is, that this consumer-centric good pharmacy practices, which Binaji motivated us to agree on, to dedicate one edition of our Aware Consumer magazine on this subject, triggered today's conversation. And I'm so happy because I fondly recall, याद आ जाता है when मंजरी जी को first time हम मिले थे, मुंबई में, किस मीटिंग में FDA महाराष्ट्र गवर्नमेंट के, दफ्तर में मिले थे, कैसे राज जी को गोवा में मिले थे, हमारा याद आ जाता है कि कितने intellectually they are active, that आज हम लोग जहां पर भी हैं, it is only because of people like them who have always educated us, made us aware, made us strong to intervene before the policymakers, lawmakers, to bring changes in the country. हमारा कई दोस्त आज जुड़े हैं. I can see Brajesh ji also has joined. Regan. I can see, of course, Narayan ji has been very active with us. Lately we have been working for the last 2 years. और हमको याद है कि कैसे हम लोग कोविड के टाइम में महामना डिक्लेरेशन बनाए और उस महामना डिक्लेरेशन को लेते हुए कई कानूनी बदलाव आया, कई रेगुलेशंस आए, कई लोगों का चिंतन हुआ, कई उनका सोच बदला। और आज हम लोग जहां पहुंचे हैं, हम सोचते हैं कि हर एक व्यक्ति जो आरजेएस पॉजिटिव मीडिया के साथ जुड़े हैं और पॉजिटिव मैसेज दे रहे हैं, हर एक व्यक्ति को फायदा मिला है इस परिवार के साथ जुड़ने से। तो हम विदाउट वेस्टिंग एनी टाइम, there are 2 very eminent speakers, and being the moderator, I would request the speakers to be as brief as possible on the theme of the subject and give maximum time to the participants to ask questions from the 2 eminent persons, Manjiri ji, who is our chief guest, and Raj Vaidya ji, who is our keynote speaker, to answer those unanswered questions, which we are all anxious to understand from them. And I must confess that we are working towards the right direction. The country is working towards the right direction. We only have to develop certain strategy. And that strategy is what we are planning and we are trying to do every Sunday at 11 o'clock. That kaise hum log aage badhe, kadam se kadam milakar, and how we can move forward. As we have speakers from Southern India, participants from Southern India, we also have participants from overseas. I would request the speakers to be bilingual, to speak in Hindi and English, because some of my participants are from the Hindi speaking belt. They're not so conversant with English. So for their benefit, we should try to be bilingual as much as possible, but keep yourself comfortable. And I would now call upon my very, very good friend, Mr. Raj Vaidya ji, who is the, as Prafull Bhai mentioned, a person who is not only committed,
recording in progress.
He is passionate about the subject which we are going to talk about. And he is not only passionate, he has demonstrated that what he speaks, or what he preaches, he practices. So he is a man of action. And the more you will know about him, the more you will be inclined to get attached to him. So Raj Vaidya ji, our keynote speaker, without wasting any more time, I would like to hand over the mic to Raj ji to kindly give his presentation and enlighten us with his knowledge on good pharmacy practices. And the magazine which we dedicated on this subject, you would have all read the great interview he has given to us in the magazine which has got covered. So Raj Vaidya ji, the mic is yours. Please come and enlighten us. Raj Vaidya ji.
Thank you very much, sir. Thank you. I would like to thank the organizers and of course, Sir Prof. Ji and Bijon Mishra ji and the other organizers for inviting me to presentation or share my views on the consumer-centric aspects of pharmacy practices. I've tried to make my presentation oriented to consumers, consumer organizations, and of course, all other healthcare professionals and policy makers are also consumers. So this is directed to them also. I try my best, as you said, sir, to speak what is on the ground. So that's the only way to accept reality, and that's how we can try to work out solutions towards that. So I'm a practicing community pharmacist, and in this presentation, I will use the words which mean the same in our country, at least for practical reasons: medical stores, chemists and druggists, medicals. Community pharmacy is a professional word for retail pharmacy or chemist and druggist. That's what we use in India. So I would like to acknowledge and also bring to notice that pharmacists and pharmacies were open throughout the country in the pandemic, right from day one, even though many clinics and doctors and some hospitals were closed. And a lot of pharmacists worked around the clock tirelessly to make medicines, manufacture medicines, as well as make them available. And it is also sometimes a sad feeling that pharmacists were not given their due as COVID warriors in the COVID pandemic. Anyway, we try to do our best. We always work on the ground and try and give best to our society. So pharmacists, and they are registered pharmacists, are the ones who are mostly in the community retail pharmacies. They can be, that's the minimum qualification is D-Pharm, B-Pharm or Pharm D. And in India, we have more than 13 lakh pharmacists in the country. Most of them are working in community pharmacies. And by law, medicines, pharmacists के supervision के बिना या pharmacist ना होने से actually by law medicines dispense या sale नहीं कर सकते. लेकिन बहुत सारे ऐसे हैं जिन्होंने कभी पूछा नहीं, कभी जाना नहीं कि फार्मेसी में फार्मासिस्ट है या नहीं है. Is the pharmacist really present in the pharmacies? क्योंकि हमारे कंट्री में unfortunately बहुत से जगह बहुत से बार फार्मासिस्ट होता ही नहीं. And in many of the states, the situation is very bad. This is all because of poor implementation of the law. जैसे हमें मालूम है हमारे देश में बहुत सारे कानून हैं, लेकिन implementation poor है. यही फार्मेसी में unfortunately होता है. Secondly, coming to दवा बिक्री, sale of medicines against prescription. As you see, a red box में लिखा है Schedule H prescription drug to be sold against doctor's prescription. Now, these are very common antibiotics, जो unfortunately कोई भी जाके मांग लेता है और उन्हें मिल जाते हैं. ये है दवा शेड्यूल जी, शेड्यूल एच, शेड्यूल H1 में आती है फॉर ब्लड प्रेशर, कोलेस्ट्रॉल, डायबिटीज, even many steroids, even many skin preparation, steroid containing skin preparation. अगेन बहुत सारे लोग इन्हें हम में से भी शायद इन दवाओं को फार्मेसी में जाके प्रिस्क्रिप्शन के बिना मांगते हैं और उन्हें वो मिल जाते हैं. दिस इज अगेन अ पुअर इम्प्लीमेंटेशन ऑफ द लॉ. सो प्रिस्क्रिप्शन या तो वर्बली मांगते हैं, या तो कोई चिट्ठी पे लिख के, नहीं तो फोन पे, नहीं तो अभी व्हाट्सएप पे होता है. कभी ओल्ड स्ट्रिप लाके या ओल्ड दवा की बोतल लाके दवा हमें फार्मेसी में मिल जाती है अभी. और इन लास्ट फ्यू इयर्स में ऑनलाइन फार्मेसी, तो घर बैठे बैठे बिना प्रिस्क्रिप्शन के भी दवा मिल जाती है. इससे प्रॉब्लम कितना सीरियस है, क्या हम जानते हैं, क्या हम सोचते हैं? It is not only getting the medicine, it is the various aspects behind that. One is a serious problem of antimicrobial resistance and inappropriate use of medicines. Medicines की misuse, abuse बहुत होती है. इससे साइड इफेक्ट बहुत होते हैं. कभी कभी डॉक्यूमेंट होते हैं, कभी कभी किसी को मालूम नहीं रहते हैं, या देश भर में क्या रहता है होता है पता नहीं चलता है. ड्रग इंटरैक्शन, सिकनेस बढ़ जाती है, हॉस्पिटल या मौत, एंड हेल्थ केयर की कॉस्ट बहुत सारी इंक्रीज हो जाती है. So I have pointed out two problems: sale of prescription medicine without prescription and presence of pharmacists, both because of poor implementation of the law. और इसीलिए मैंने ये सवाल यहाँ पैदा किया है, how consumers and consumer organizations can help. This is something which pharmacies and pharmacists cannot do alone. We need the help of everybody. क्योंकि when pharmacies refuse to give certain medicines, बहुत सारा हंगामा हो जाता है, and this becomes a very difficult situation. So implementation of the law, अगर implement हो गया, तो it will benefit greatly not only public but healthcare in India. There are other challenges in pharmacies, drugs and fixed dose combinations. More than 5,000 are there in the country. Nobody knows the exact numbers. Brands or products in the country कितने हैं किसी को भी मालूम नहीं. ड्रग कंट्रोल डिपार्टमेंट को भी नहीं मालूम होगा, या 1 लाख है, या 2 लाख है, या 3 लाख है, 3 lakhs. Then brand substitution is a problem, and expiry, which is a national waste, is also a huge problem in our country. A lot of money is lost and wasted in that. So pharmacies have stiff competition, and of course pricing or discount का war बहुत चलता है. इसमें क्या हुआ है कि प्रोडक्ट डिस्काउंट, मार्जिन्स, इसके बिकॉज ऑफ दिस जो हम लोगों ने जो काम शुरू किया था टू शिफ्ट फोकस फ्रॉम प्रोडक्ट टू पेशेंट, यानी पेशेंट को ध्यान में रखते हुए जो ट्राई किया था, वो अब धीरे धीरे फिर रिवर्स होता जा रहा है कि ऐसे लग रहा है. आर वी गोइंग बैक टू प्रोडक्ट focus, just talking about discounts and availability. So this is the Good Pharmacy Practice Training Manual, which was developed by Indian Pharmaceutical Association along with WHO and the Drug Controller General of India. And Dr. Brijesh Regal was leading this activity. I'm very glad that he is also present here. And this is one of the landmarks that Indian Pharmaceutical Association was able to do. So due to this, a lot of pharmacies have started following this after that. So good pharmacy practice involves a practice of pharmacy that focuses on the needs of the people. So what people need to be given is correct and evidence-based care. And the pharmacist's concern, of course, has to be primarily the welfare of the patients. So all activities at the pharmacies have to be done appropriately, and patient focus and public health is very important. So if we don't have the two basics, that there is no pharmacist and there are medicines available without prescription, then GPP unfortunately loses focus. Of course, there are many pharmacies who try their best to follow good pharmacy practices, because the foundation of GPP is, of course, the law. And GPP is one step above the law. So only when you follow the law, you can further expand and work on GPP. And if you follow good pharmacy practices, then that's the next step to get accredited. So medicines and other healthcare products which are supplied through the pharmacies have to be of assured quality. So GPP lays down those principles, and the standard operating procedures which are laid down help the pharmacists to follow these so that the correct medicines are procured and the correct medicines are also dispensed along with advice to the patients. So pharmacists thus can contribute to promotion of rational use of medicines, and so that there is cost benefits and medicines are appropriately available. I'll just give a few running examples of some pharmacists who are doing good active work. This is Mr. Sagar Kulkarni, B.Pharm from Kalyan, Maharashtra in Yashasvi Medical Stores. He does a lot of health promotion activities, demonstrating devices, doing blood pressure measurements. He has been a DOTS provider, conducting health camps for benefit of patients, diabetic neuropathy check for his diabetes patients from time to time. This is a healthy Sunday activity, which he does every Sunday, calls his patients for checking their blood pressure and blood sugar and height, weight. So it's not only dispensing medicines, but is also taking other care of other aspects of the patient. So he's the Center for Pulse Polio, giving pulse polio. He does nebulization services on the prescription of his neighboring doctors. Then he does education of patients through videos and information leaflets. This is us at Hindu Pharmacy. In the last 25 years, we have created a separate patient care area in our pharmacy, which is dedicated to measuring blood pressure and blood glucose, where we get itself more than 100 patients every day, guiding on minor ailments, giving counseling to patients, and referral to doctors what we are not able to handle, and providing different patient information leaflets. So every antibiotic that is dispensed is along with this leaflet and a sticker, ensuring that the patient understands why it is given. Some brief information about diabetic medicines, what care they should take. This is a pharmacy in South India where professional aspects are being promoted. This is in Coimbatore, Tulasi Pharmacy. This is a young dynamic pharmacist in Hyderabad, Maddox Pharmacy, who is doing full professional services, providing dispensing labels to the pharmacy. He and along with his wife, both are pharmacists in their professional pharmacy, doing medication management reviews for their patients, dispensing prescription drugs, of course, along with good labeling. He puts his own labels as well as cautionary labels, doing blood pressure measurements and consultations on blood pressure, blood sugar, giving guidance. And these are some of his labelings of the medicines that he dispenses in multiple languages for his patients. Smoking cessation program for his patients, and giving them medication profiles, how they should use their medicines correctly in writing. So this is IPA's Community Pharmacy Division, initially headed by Dr. Brijesh and now headed by Manjiri, doing a lot of activities to promote for the patient as well as promoting for pharmacists. So this is a flagship project which was headed by Manjiri for DOTS pharmacists. So they were the DOTS providers in their pharmacies along with the Government of India. These are patient-related information posters that we have created. This is a booklet on responsible use of medicines for the laypersons, giving simple information and tips. This is every year celebrated in the third week, the National Pharmacy Week. The Community Pharmacy Division spearheads in preparing all the material. And this is the latest initiative of IPA along with the FIP to train pharmacists to vaccinate. Just last week, we have trained 45 PharmD faculty and PharmD students who will be trainers to train other pharmacists to vaccinate. So eventually, as we spread this across, pharmacists across the country will be able to vaccinate, including in retail pharmacies down the year. So this is a very interesting piece of history which happened last week. So National Pharmacy Week this year focused on joining pharmacists to ensure patient safety. So the information material and disseminated was focused and related to that, because we believe that patient safety has to be primary, but at the same time, pharmacists cannot do it alone. The patients have to cooperate, and then only we can take this forward. So the pharmacists in the community pharmacy can do a lot. Can do professional dispensing, checking of prescriptions, checking for adverse effects or drug interactions, giving instructions to patients, counseling of patients, providing dosage labels and ancillary labeling. Some of the pharmacists are already doing it, providing patient information leaflets about medicines and diseases. If the pharmacists get access to patient medication records, they can do monitoring of side effects, monitoring of drug interactions, then responding to symptoms of minor ailments, then medication therapy management, how the patient can benefit from the pharmacist's role in monitoring his therapy along with the doctor, providing drug information, and a lot of screening services. Some of these are already being done, and like blood pressure, blood sugar, and tobacco cessation clinics, vaccination. This is now a reality, going to be a reality, and in future we can also have diabetic clinics and hypertension clinics. So a lot of things that can be done by community pharmacists, the foundation for which, of course, number one is the law, and second is good pharmacy practices. So with this brief, I will end, and thank you once again for allowing me to share my insights. Thank you.
Thank you very much. Raji, thanks a lot. You have brought in a beautiful dimension in terms of some of the strong warriors in the pharmacy world in India, and you have showcased them. You have spoken about a few, but I'm sure there are a large number of such soldiers working relentlessly for the benefit of the consumers. I would hold on to my question, and my participants, please hold on to your questions. Raji will be with us till the end, I'm sure, to answer questions, and we will have a very productive, interactive session, which will lead us to a very positive movement to work towards, as what he has explained, as consumers, what role we can play. Without any further wasting of time, now I would like to go to our chief guest, and I always feel very delighted when I find a woman taking a leadership. You see, I am one of those persons who always believe if a country has to develop, the women empowerment has to be maximum. And we in India are today not only talking about it, but we are demonstrating it. Like Manjiri, she is representing India in the global world. And we are so proud that she is the Vice President of FIP, and we feel very proud in terms of her leadership. Now, Manjiri would tell us what is that agenda for India in the coming years and how we as consumers can play a role. तो मंजरी जी, आप प्लीज माइक को अनम्यूट करके आ जाइए और हम लोग को मार्गदर्शन दीजिए कैसे हम लोग आगे बढ़े और किस ढंग से बढ़े ताकि आपके साथ हम लोग कदम मिलाते हुए आगे बढ़ते रहें। तो मंजरी जी, आपका विजन, आपका मिशन और आपका लीडरशिप के बारे में जरा बात कीजिए आज हम लोग के सबके सामने। मंजरी जी, माइक इज योर्स।
यस, थैंक यू सो मच बिजॉन जी। नमस्ते सभी को, नमस्ते and again good morning, and thank you so much for this opportunity. I feel extremely happy, delighted, privileged and grateful to be among my mentors and my seniors here. Prafull ji is my mentor, and he has played an instrumental role in shaping my career as well as Raj's career. I'm very grateful to Dr. D.B. Narayana. That time, my first project, Bijon ji, was for patient information leaflets, which we did with Dr. D.B. Narayana, Delhi Pharmaceutical Trust. Prafull ji is here. And I'm very happy because my colleagues for last more than 2 decades, Raj is here. Also, Dr. Brijesh Rigal, jinka kaam maine bahut dekha tha. But after that, I could not get much interaction. I could not get much opportunity to interact with him. Dr. Saravdekar here. Some of our pharmacy colleagues from Community Pharmacy Division is here. And many seniors who have joined from India as well as abroad. So नमस्ते सभी को फिर से, थैंक यू। एंड बिजॉन जी, आपने कहा था कि बायलिंगुअल बोलिए, सो आपको बम्बईया हिंदी सहन करनी है तो मैं हिंदी में बात करूंगी। Otherwise my English is very
I thought you will also use little bit of Marathi.
Yeah. No,
हम अपना बंगाली हिंदी यूज करते हैं, आप प्लीज मराठी हिंदी यूज कीजिए।
नहीं, दिल्ली वालों के सामने हम बहुत डरते हैं बम्बईया हिंदी बात करने। So yes, so
दिल्ली तो दिल वालों की है, डरने की जरूरत ही नहीं.
Yes, thank you for those kind words. So again, so I bring you all the greetings from International Pharmaceutical Federation, FIP, as well as Indian Pharmaceutical Association. Both of the organizations are working towards the same goal, that is the advancing global health, advancing national health, and improving the scope of practice of pharmacist. राज ने अभी बहुत अच्छी तरह से बताया है कि रोल ऑफ कम्युनिटी फार्मासिस्ट क्या है, और हम सभी भी जानते हैं, लेकिन होता क्या इंडिया में हो रहा है वो उन्होंने बताया, लेकिन क्या होना चाहिए, रोल क्या है, ये भी उन्होंने बताया. ग्लोबली लिटरली जब हम फार्मासिस्ट का रोल देखते हैं, इट हैज एक्सपांडेड सो मच दैट इट इज बियॉन्ड आवर इमेजिनेशन. जैसे हम स्पेशलाइज्ड फिजिशियंस देखते हैं, वैसे फार्मासिस्ट भी स्पेशलाइज्ड हो गए हैं. डायबिटीज में स्पेशलाइज्ड है, हाइपरटेंशन में है, टोबैको सीजेशन में है, एंटीकोएगुलेंट क्लिनिक्स रन कर रहे हैं. So it is really way beyond our imagination. The pharmacy practice has evolved. During COVID, pharmacist and the pharmacy profession has shown its value, demonstrated its value, which was never before seen and appreciated much by the world. So pharmacist globally is a true healthcare professional. और हमारे कंट्री में जैसे अभी तक दुकानदार है, मेडिकल वाला है, केमिस्ट है, वैसे नहीं है. A true healthcare professional who is the link between the doctor and the patient. And whenever consumer polls are taken, like Gallup polls हो या दूसरे किसी नाम से पोल हो, कंट्रीज में जैसे कि यूके है, कनाडा है, जब भी कंज्यूमर पोल्स लिए हैं तो फार्मासिस्ट ने हमेशा पहले 3 क्रमांक में नंबर रखा है. Either pharmacist is computing with nurses या फार्मासिस्ट टॉप पे है. सो फार्मासिस्ट का ये रोल है और फार्मासिस्ट की ये इमेज है, और समाज के मन में, कंज्यूमर के मन में उनके लिए बहुत अच्छा रिस्पेक्ट है, और वो खुद को फार्मासिस्ट को एक फ्रेंड मानते हैं. फार्मासिस्ट इज कंसिडर्ड एज अ ट्रू फ्रेंड ऑफ अ कंज्यूमर, अ पेशेंट. स्लोली जैसे राज ने बताया, प्रोडक्ट सेंट्रिक प्रैक्टिसेस से हम पेशेंट सेंट्रिक प्रैक्टिसेस पे आ रहे हैं. We believe कि फार्मेसी प्रोफेशन एंड फार्मेसी प्रैक्टिस ये मेडिसिन के लिए नहीं है, वो दवाइयों के लिए नहीं है. हम सभी हैं फॉर द कंज्यूमर, फॉर द पेशेंट who is the end user of our medicines, and therefore this patient centric practices. Now FIP says the person centric practices and the population, the people centered care is one of the development goal for the FIP. And that's where we are working towards. That is the direction where we are working towards the people-centered care, जिसमें patient safety है, जिसमें education से लेके regulation तक सभी है. और हमारे कंट्री में हमें फार्मेसी प्रैक्टिस इंप्रूव करनी है. जैसे प्रफुल्ल जी ने बताया कि पिछले 20 साल से या उससे भी ज्यादा हमारी कोशिश तो जारी है, लेकिन सिग्निफिकेंट इम्पैक्ट अभी तक नहीं हुआ है. लेकिन जरूरत तो हमारे कंट्री में कंज्यूमर सेंट्रिक फार्मेसी प्रैक्टिस की बहुत ज्यादा है. आज की तारीख में वो और ज्यादा हो गई है, क्योंकि पहले के जमाने में इन्फेक्शियस डिसीजेस ज्यादा थे. अभी एनसीडीज, लाइफस्टाइल डिसऑर्डर्स हैव इंक्रीज लाइक एनीथिंग. 45% of the disease burden is non-communicable diseases because our lifestyles have changed and we have invited the troubles like diabetes, cardiac disorders, hypertension, arthritis, cancer, addictions, and therefore the role of pharmacist has increased. Aging population. So NCD is one thing. Second is aging population. We all live a very long life, but that long life, that extended life is not healthy. The quality of life is not that good because we all have to depend on the medicines because our health promotional activities have gone down. So the aging population and the NCDs and demand that the pharmacist can play much bigger role. So consumer centric pharmacy practice बहुत जरूरी है. आज हम सोच रहे हैं कि 10 लाख से ज्यादा फार्मेसी के दुकान कंट्री में है. जस्ट इमेजिन कीजिए कि हर एक दुकान में फार्मासिस्ट अपना सही रोल कर रहा है. पेशेंट आ रहा है, फार्मासिस्ट पहले तो जगह पे है. जैसे राज ने बताया, बहुत सारे स्टेट्स में फार्मासिस्ट दुकानों में नहीं है. And this is not this is the open secret that drug regulators also know and we also know. Who doesn't know that? The consumers don't know that. And that is the role that we need to play, that we have to wake up and shake our consumers, and we have to educate them that the pharmacist is needed in the pharmacy, and it's not just needed as a showpiece. Pharmacist है तो कोई ऐसे कॉलेज से फार्मेसी बन के आता है जिन्होंने कभी अटेंड ही नहीं किया, शायद आप लोगों को पता नहीं, लेकिन कंट्री में ये भी रॉन्ग प्रैक्टिसेस हो रहे हैं कि जब लॉ एनफोर्स हो रहा है फार्मासिस्ट चाहिए दुकानों में, तो ऐसे भी कॉलेजेस आ चुके हैं एजुकेशन सेक्टर में जहां फार्मेसी स्टूडेंट अटेंड नहीं करता, पैसा दे के उसका डिप्लोमा या डिग्री बन जाता है. इट्स अ सैड स्टोरी. सो हमें ऐसे फार्मासिस्ट की अपेक्षा और उम्मीद नहीं है. हमें ऐसे फार्मासिस्ट चाहिए जो दुकान में बैठे और जो दुकान में पेशेंट सेंट्रिक, कंज्यूमर सेंट्रिक सर्विसेज ऑफर करें, जो पेशेंट काउंसलिंग मेडिसिन के लिए करें, पेशेंट को अच्छी सलाह दे, बिकॉज हेल्थ लिटरेसी इज वेरी पुअर इन द कंट्री एंड मेडिसिनल लिटरेसी इज नॉट देयर. औषध साक्षरता, मैं बहुत साल से मराठी न्यूज़पेपर्स में लोकसत्ता और महाराष्ट्र टाइम्स में कॉलम्स लिखते आई हूँ कंज्यूमर्स के लिए अबाउट मेडिसिन, and we get great response. We get a lot of queries because consumers are not aware of this. So to improve the practice in our country and to have it as a consumer-centric practices, I think we need to work on the education sector, from education to the regulation. Because today, whatever you see as a pharmacy practice, ये pharmacist का दोष है क्या? नहीं है. It is the entire system is at fault, right? I mean, up to the policy makers, from the consumers to the policy makers, because we have not created a right ecosystem, conducive ecosystem for their good pharmacy practices. In other countries, when the pharmacists are acting as a true healthcare professional, their education has developed them that way. The regulations are so, policy makers are supportive, they get remuneration. But in our country, that is not the scenario. So we are working at IPA with the support of FIP. Late president of FIP, Dominic Jordan, has supported us like anything, writing letters to the policy makers about the role of pharmacists, as well as supporting the GPP, and even the current president and Paul Sinclair. You can see his article in the wonderful issue which we have come up for the month of December, the Aware Consumer. So they are all supportive, and they are all helping us to see how we can work towards improving the practice in our country. Because if they believe that we are the largest populous country in the world, so if we can improve the pharmacy practice in our country, that is going to contribute immensely in improving the population health in our country. That means we are improving the global health, 1/6 of the population we have. And so if we can work on that, that is something that they are also looking forward to, and we get all the support, whatever we want from them. Now I'm coming to end of my small talk because I know we need an interaction. But since here the media is here, since here the consumer organization is here, because Bijonji is doing a lot of work along with his colleagues for the consumers, I want to strongly put forth one thing, that we will work with policymakers, we will work with educationists, we will train the pharmacists, sensitize the pharmacists, we will do everything. But who is the king of the market? The consumer. Consumer demand for the pharmacist and the role of pharmacist has to increase. And we have to sensitize the consumers in every nook and corner of the country through maybe the media. Now the print media, when you talk of print media, yes, we can write articles in Hindi through IPA. Some of you can write it. And then we can send a reach to consumers. But again, the consumers are not reading the newspapers to the extent that needed. And if you talk about the young generation, they don't read much. My own students hardly read the newspapers. Some of them, most of them do not get hard copy newspapers at home. So, okay, we do that section. Yes, we do. But still we'll write in the newspapers. Secondly, some of you might have very close associations with Doordarshan, Hindi Doordarshan, national. We need to have series of programs on the national TV, as well as on All India Radio or other community radio. It's not that we did not have. I think we had some isolated episodes on the Hindi channels. But then we need to have, 10 minutes episode or something every week Maybe one episode is just focusing on what care will you take while purchasing the medicine. Next one might focus on the good storage practices. Following that, we can talk about acidity drugs. We can talk about hypertension drugs, what care consumers should take. We can have a pharmacy in the background and a talk, a role play, and then somebody talking about it. Something of that sort, so that the people feel like looking at it and feel interested, do not feel bored. So we need to really work hard on that. In Maharashtra, we are using Doordarshan. I have been with my colleagues many a times through Mumbai Grahak Panchayat, which is a very active consumer organization in Mumbai. So we had a lot of programs on Doordarshan also, or otherwise also. But then we need to do it as one of the strategy. We are talking, Bijonji said what strategies we can develop. So one of the strategy would be consumer sensitization at all levels through all channels, community radio, all India radio, Doordarshan or any other channel, print media also. We need to work on that or create small videos and throw it through social media because people watch it. Something of that sort in a very systematic way we need to do. And we need to also work with the policy makers for enforcement of the law, which we are trying. We are not successful yet, but we keep trying. Then educational programs for the pharmacists we have been doing. But then so we need to, sensitize consumers, ask for the pharmacist, whether there is a pharmacist in the shop or not. And then also expect the services. When the consumer starts asking the pharmacist, मुझे ये बताओ कि ये खाने के बाद खाना है, डॉक्टर ने क्या लिखा है चिट्ठी में, इसमें कोई एंटीबायोटिक है क्या? Let consumers start asking. Then pharmacists are going to realize if there is a non-pharmacist is going to tell कि ऐसे सब पूछ रहे हैं, तो उनको करना ही पड़ेगा. So we need to work on their this aspect a lot. And I think we all together, you're all very senior professionals and with maybe higher connectivity with many sectors. So I think we can all together, we can work in this direction. Again, thanks a lot for this opportunity. I'm really privileged to be in this group of intellectuals and senior intellectuals here. And I must congratulate the latest consumer aware, the aware consumer issue is excellent. I have sent it in so many of my circles in academics as well as the pharmacists. Raj's interviews there, Paul's article is there. All articles are excellent. And Beena ji ko dhanyawad mera ki unhone ye theme aur ye issue ke liye ye theme banaya. So thank you so much, everyone again. And I'll be very happy to work with Bijon ji ne kaha ki guidance de dijiye. Main guidance, I think it is a mutual thing. You're all seniors. You guide us. We give you suggestions, and we work towards together towards this cause, leaving no one behind in the country. Thank you so much.
Thank you. Thank you very much. Manjiri ji, thank you very much. You have provided us with a lot of thoughts in terms of how we can move forward. Before I open up in terms of asking questions, we have very prominent experts participating, and I would like the experts also to come in and answer some of the questions which participants would ask, especially like Dr. Narayan, Dr. Brijesh ji, Dr. Suresh, who all are participating, Dr. Rai. They are all very prominent people. I'm not expecting questions from you all. You all are the wisdom. You all are the warehouse of answers to the questions. So I would request, allow non-professionals to give or ask questions like us. We would like to ask questions because we are not from the profession. And people from the profession, please answer apart from our chief guest and the keynote speakers. That's my suggestion. And I would like to open it up. But before I open, Suresh ji wanted to show a 4-minute video. Suresh ji, please come and show the video. Unmute and come. Please unmute your mic. You want to share a prize-winning video of the UN. We would love to watch it. It's for 4 minutes. We would like to watch it for 4 minutes. Suresh ji, the screen is yours. Please come and share.
Okay. 1 minute. So,
Are you able to?
Yeah.
Please help him.
I'm just, yeah, 1 minute. I'm trying. 1 minute.
Go ahead.
Can you see?
Technical team has allowed him to share their video.
Please go ahead, Suresh ji. Show the video. Okay, while we are getting ready for Suresh ji to show us the video, can we have some questions from the participants? Please come, unmute and come one at a time.
Hello? Sorry, you can see now?
No, we
Hello?
can't see. No, not yet. No, not yet.
You can't see?
No.
No.
So what I have to do?
You have to go to the share. You have to go to share, then go to your screen.
Yeah, it is already.
I have given you WhatsApp number. You may send your video in WhatsApp. I have given in chat the number.
Suresh, you can send the video to the backend team on the WhatsApp number which Uday Manna ji has put on the chat box. In the meantime, please, participants, start asking your questions.
1 minute. 1 minute.
Yeah.
Can I see now?
Yes,
Yes.
you put on that video.
Can you see it?
Want to share. You put it on. You go and press it. You press it and show it.
Sorry?
Play the video. Play the video.
Oh, it is already clicked and showing me.
No.
No, you are not playing it. You are showing the reel, but you are not playing it. Backend team, can you access?
Okay.
No, we are not able to see it. It's not
video. Not video is not available.
Suresh ji, we'll come back to you. We'll come back to you.
Yeah.
Okay.
1 minute. Can you see?
Right. Yeah, now play it.
Now it will come.
Now you play it. You put on play.
Sorry?
Yes.
Can you see?
Yes,
Yes,
you can see.
You play. Yeah, there you go.
Huh?
Play. You are not
Play it, sir.
Sorry?
Leave it now. Put your volume on.
Can you see it?
Yes, we can.
Okay.
Moving. Play.
No, it is not working well. It is not working well. I think there is a problem with the...
Can you not able to see it?
No, we can see, but
we
this
are
is...
not able to. Suresh ji, we'll come back to you later. I think we'll come back to you later.
Yeah, proceed with other program.
Yeah, please go ahead.
Okay.
Backend team, you can disconnect.
Okay.
Okay, friends, I must tell everybody, including Manjiri ji, she mentioned about the magazine. We have our consultant editor, Payal, with us. So Payal, congratulations. Everybody is appreciating the edition of the December edition, which you have dedicated on good pharmacy practices. So thank you for taking the leadership and giving us such a beautiful magazine content in the interest of the consumers. I must acknowledge that our Prafull Bhai played a very key role and a pivotal role in guiding Payal in not only getting the interviews and the opinion pieces through Manjiri and Raj, but he also helped her in identifying the best of content, which today all of you are accessing through this magazine. So congratulations once again to Payal and the team for bringing out such an excellent edition. I would like
Thank you, sir.
I would like to introduce Dr. P. Ramarao, who is the chairman of the Consumer Coordination Council, which is the apex body of the consumers in the country, where I was at one time the founder, governing council member, and also the chairman. So Ramarao is the present chairman. He's based out of Vizag. Ramarao, you have anything to share, any questions to ask from the eminent speakers and also the experts who have joined this group? Please go ahead and share your views.
Thank you, Mr. Bijon, giving me the opportunity. But except one saying that the pharmacist or pharmacy department is a pivotal role between a doctor and a patient. Unless the pivotal role plays properly in creating awareness among the consumers, that these people are doing wonderful work. So I must congratulate all the speakers. You have done an excellent input. And this should be put on even YouTubes and the general channels also, instead of print media, so that it will create a lot of awareness over the pharmacies, that is like how to use and how to take care of the side effects, when to report, and all these things also. The role is only by the pharmacists. Thank you very much, sir.
Thank you, Ramarao. Thank you very much. You know, you have very rightly said, I must tell all the participants that RJS Positive Media, led by Uday Manna ji, they are not only recording this show, they will put it on the YouTube. Everybody can access the proceedings of today's consultation on YouTube. So please do not hesitate to go to the RJS YouTube link to access the conversation which we are having today with the eminent experts who have joined us on this conversation. Having said that, I would like to go to Professor Ramaiah, who is staying awake till midnight to reach us. Professor Ramaiah, you have any questions or you want to share anything, please go ahead.
Thank you for the opportunity. I have a couple of comments, couple of questions. Because of the time constraints, I just restrict myself just one. And then if time permits, I ask the Misra ji, you can give me some time later on. My question is this. In my opinion, pharmacy is a noble profession. Unfortunately, that is not being recorded anywhere. Now take some of the pharmacy colleges you see in some parts of the country where I am much familiar. They are in extremely, extremely bad situation. All the IPAs and other people should raise their hands what to do with these people. What kind of jobs they are going to get. How many people are becoming really pharmacists? They are spending 4 to 8 years in one profession. At the end, what are they getting? Managing the medical shops? That's my comment. And again, I appreciate both the speakers. You have given excellent some of the shortcomings of the profession. I really appreciate it. The one thing I want to bring it to none of the schools that I am aware of it, they don't teach the compounding, that in a dying art or dead art. Unfortunately, many of the medicines today need the compounding pharmacists. And I ask or request some of the managers who are the administrators of the colleges, think about having that one. That's my request to you. Thank you.
Excellent. Excellent input you have given. I can see the hand has been raised by none other but our expert, Dr. Narayan. Dr. Narayan, please.
Unmuted. Yeah. Very interesting session. And since the focus is about consumers and not the pharmacist and the pharmacist role, I just want to give two suggestions and one input. Manjiri drew attention to a lot of projects that Delhi Pharmaceutical Trust took initiative. They are not big projects because of money and so many, but intellectually high, rich projects they were. One of the projects that we did in Delhi Pharmaceutical Trust, we had conducted a consumer survey following what good marketing companies do. And that involved both qualitative and quantitative survey. The quantitative survey was across the nation, involving 9,000 consumers, both from rural and urban area. And quantitatively, analysis was done using statistical software tool. These reports are published. Manjiri was also part of that for Maharashtra area, and it was done across the country. And I led this project as part of Delhi Pharmaceutical Trust initiative. And two outstanding or first points that came out was whether you call him a chemist or a pharmacist was trusted next to a doctor across the country in both rural and urban areas. And whatever the second important finding was, consumers more and more first go to a chemist or a pharmacist to look at what he can take or apply for most day-to-day issues. And when a chemist or a pharmacist gives them some medicines, which could be including antibiotics, which is legally not correct, but they would take it for 1 day or 2 days. And if they don't get relief, then they go to a doctor. So this is a big shift that has occurred in the country. And this survey, I don't remember exactly, maybe it's 7 or 8 years old. Since this talk today, since this issue has been raised more from the consumer-centric, I think if organizations, what Bijon leads or any other organization, can reconduct another focused survey to see what are the consumer perceptions and requirements today from a chemist or a pharmacy store, that would give us an idea how we should move forward in this area. Second is, while I think many people in this group may recommend to look at regulation and forcing the government, I think regulation should be the last approach that we should try. But this is a social change that we need to bring. And social changes don't happen overnight. So we have to work patiently. Whatever good pharmacy practices that we may try to incorporate, even in 30%, 40%, or whatever percentage of chemist shops across the country, will impact two people. One is the consumer, and the second is the pharmaceutical industry. Because when good pharmacy practices is growing, their sale will go down, because without a prescription, nobody will give medicines. Without a doctor's involvement, it won't, and consumers may not want to go to a doctor. So therefore, I would suggest the group to consider strongly that pharmaceutical companies must be made to spend out of their corporate social responsibilities on this area of consumer-centric medicines which they manufacture and sell. So therefore, they would be a partner in the whole issue. Then I think the whole area will move forward. Because today, if our approach is right, sale will reduce, and therefore they will, object to that. These are the two.
Thank you. Thank you very much. You have actually touched the right button, and we would develop by the end of this conversation a kind of a brief roadmap in terms of how we intend to move forward. Binaji, you raised your hand. I observed that. Please go ahead, unmute and come. Binaji.
Thank you, Bijonji.
And please keep it short, because many people
very short.
Many people are in the queue. So I would like to give opportunity to everybody who are participating to go back answered with their anxieties or the questions they have got. Binaji, the turn is yours.
Okay, thank you. मेरा क्वेश्चन राज वैद्य जी से है पहला. आपने कहा कि ये बहुत ही प्रैक्टिसेस गलत हो रही हैं और लॉ है बट इम्प्लीमेंट नहीं हो रहा है, प्रॉपरली इम्प्लीमेंट नहीं हो रहा है, तो उसका कैसे हम इसको फोर्स करें या उसको कोशिश करें कि वो राइट वे में इम्प्लीमेंट हो.
Raj Vaidya ji, are you there? Would
Yes,
you like
yes.
to answer it now?
Yeah. So हमें हर तरफ से स्ट्रेटजी बना के उसको पुश करना है, right from consumers, doctors, lobbying with the activist, bureaucracy, drug department, politician. It is
राज जी, एक चीज याद रखिए, जो नारायण जी भी बोले हैं, हम लोग के पास सीमित साधन है। हमारे सीमित साधन से हम लोग कैसे ये एडवोकेसी को ऐसा रूप दें कि सरकार के ऊपर एक दबाव आए और वो मैंडेटरीली कानून को सही ढंग से चलाए। लेकिन हमारे पास दूसरा कुछ उपाय हैं जो हम लास्ट में कहना चाहेंगे, लेकिन बीना जी, हम लोग आपको इसका जवाब जरूर देंगे by the end of this show. Before you propose your vote of thanks, we will come back to you again with your questions. You've got the last say. Don't forget, you've got the last say. You will give the vote of thanks. So I will like to give opportunity to other people. So okay. Don't mind. Yeah. Suresh ji, you wanted to come. Please come.
Hello.
Yeah, go ahead.
Hello.
Please.
Yeah. Hello. See, I wanted to show the video. Since after my retirement as Assistant Director, Pharmacy from Maharashtra government, and having associated with Banaras Hindu University, as Bijon Mishra said, no, we met there. So I am trying now some in the rural areas of Maharashtra, especially tribal areas, where we are trying to put some health projects through one of the NGO. I am heading that health projects. That is what the video about it. Here what I did is that I have selected one couple from a community, from a village, from the tribal village, and I have trained them in using this diagnostic kits like blood pressure, blood hemoglobin, height, weight, then how to calculate BMI, and simple things like blood pressure. So usually the village is about the 30 huts together. So usually these people, they go door to door and collect the data. Now from that data, what we call it as the Parivar Swasthya card is prepared, and from that Parivar, or what we call it as a family health card, the Gram Swasthya Nakasha उससे बनाते हैं, और वो ग्राम स्वास्थ्य नकाशा हर एक के समाज मंदिर में या गांव में लगाते हैं. उसका बहुत अच्छा रिस्पांस है, because we have selected the community, and that is the couple, male and female.
Surajji, we have understood what you are doing. We will again try to bring and showcase that. How we will do that, we will understand by the end of this program. We will try to sum it up in terms of that excellent work which you are doing in Maharashtra.
Just one minute.
Please.
So now that data has been converted, digitalized in a locket, and it is a wearable locket, and the QR code is given to that data. So whenever a tribal man or person goes to the doctor, he has to just carry that locket, and locket is opened, that QR code can be scanned, and the doctor gets the data. So this particular project, we have got a recognition at the United Nations also. So that is what I wanted to
say. Very good. So as you know, the National Health Authority is also working towards digitization of the health records of the patients in the country.
Yeah.
How we can expand the Ayushman Bharat, how we can expand to ensure quality is achieved in terms of healthcare. All small islands are created in the country in terms of doing such projects, but how do we integrate all this data into one place is the biggest challenge which we are facing today, and we need to find a solution to that. Having said that, Sudeep Sahuji, next person. Sudeep Sahuji.
नमस्कार सर, मैं ये जानना चाहता हूं कि ये जो गुड प्रैक्टिस है या फार्मेसी की पढ़ाई जो है या इससे संबंधित कानून क्या होम्योपैथिक या आयुर्वेदिक दवाओं पे भी लागू होते हैं कि उनको भी इसी कानून के तहत कवर किया जाता है? इसके ऊपर थोड़ा सा प्रकाश डालिए. शुक्रिया.
Manjiri, you will take that question, or Rajji will take that question?
Sir, anyone. Some of the words what he spoke could not be heard. I think he's talking about Ayush medicines.
Yes, he is talking about.
Yes, I am talking of Ayurveda and homeopathic.
He's talking about all Ayush treatments like Unani, like Siddha, homeopathy, Ayurveda. Do they also have any kind of a law regulating in terms of prescriptions or any kind of a law regulating the dispensation or good pharmacy practices of these products?
I think the first part, yeah, thank you, Bijonji. First part he said was about pharmacy education. So pharmacy education as such does not cover the Ayush medicines in depth. Okay, so there are passing references in pharmacognosy subject, but there is no particular subject dedicated totally to the Ayush medicines, especially Ayurveda. We still talk about herbals little bit, but nothing about homeopathy and not much about Unani also. When we are talking about the GPP, so Raj can tell you more, but GPP, I mean, when we talk about the dispensing of homeopathic medicines or Ayurvedic medicines, as such, the license is not required for the Ayurvedic medicines for the dispensation. So it is more of Ayush medicines or more of OTC medicines, I would say, in other terms. And so there is the GPP, what we are talking about, we have not focused much on Ayush medicines yet. But then these Ayush medicines are more of OTC, so which do not require a prescription, but we always advise the consumers that they should go to the expert and then ask whether they need these medicines, because unnecessarily taking Ayurvedic medicines or herbal medicines, again, which are not of proven quality always, is a harmful thing in the long run for the patients also, because nothing is side effect free in this world, even the Ayurvedic and
thank you. Rajji, so, you want to add anything more?
Yes, sir.
Yes.
So
please.
good pharmacy practices can be applicable for any aspect in the pharmacy. So it could be relating to procurement, it could be relating to stocking and providing.
Excellent.
The details of medication, etc., are not necessarily covered in good pharmacy practices. So basically, it is about how to handle. So at least that part can be covered.
Very good, very good. And in fact, I must tell Sahuji that there is a lot of work going on in terms of integration of all the treatments and bringing in regulations in terms of not only good pharmacy practices, but also in terms of how do we ensure patient safety and things like that. So, aapko avgat karayenge once things are made more clearer, because a lot of now technical committees and councils have been formed under the various segments of Ayush. So many scientists are working. You will be very happy to know that हम recently Chennai में थे, जहाँ पर सारे होम्योपैथ लोग मिले थे, एकत्रित हुए थे, और even though there was a warning that there's going to be a cyclone, the hall was full of 1,000 students and all stakeholders to attend that event. It was a grand event, and very soon Aware Consumer will be covering some of those aspects in the January edition of our magazine. So you will be able to know more about Ayush and how Ayush is progressing to give a good option and a choice to the consumer to access quality care in an affordable price. So Ishaq Khan ji, next turn is yours. You want to come in? आपका कोई प्रश्न है?
सर जय हिंद सर, मेरे सवाल को साहू जी ने पूछ लिया सर, और मैं बस ये चाह रहा था कि जो एक गांव में झोला छाप डॉक्टर कहे जाते हैं सर, उनका बहुत बड़ा रोल होता है कहीं कहीं पर, जहां की प्राथमिक स्वास्थ्य के लोग नहीं पहुंच पाते, वहां उनका रोल काफी महत्वपूर्ण होता है। तो मैं चाहता था कि उनको कोई ऐसी संस्था हो, कोई ऐसे इंस्टीट्यूशन हो जहां उनको थोड़ी सी ट्रेनिंग दे दी जाए, थोड़ी सा प्रशिक्षण दे दिया जाए, जिससे कि वो अपना रोल अदा कर सके, और उनको एक आदेशित कर दिया जाए कि बस इतने एरिया में, इतने क्षेत्र में ये बीमारियों के लिए आप देखभाल कर सकते हैं। ऐसा कुछ हो सकता है सर?
मंजरी जी, आप कुछ कहेंगे इस पे? कुछ तो एक्सपेरिमेंट्स किए थे स्टेट गवर्नमेंट्स ने।
Yes. Yeah. So these are called a jhola chhap, quack doctors or bogus doctors. There are so many names for this. And I can tell you that in Mumbai, near Dharavi, there have been Dharavi slums, the biggest slum in the Asia. So there have been experiments done by the Mumbai Municipal Corporation also, training the Jhola Chhap doctors who are around the slums, because people in the slums had been going to those doctors only and not beyond that. So even if the consumers' patients are going there, so let them train and give them basic information so that at least they will correctly give the treatment to the patients. And secondly, when I was attending one of the workshops long time ago of WHO in IIHMR in Jaipur, the WHO said, I mean, I think they are also focusing sometimes on Jhola Chhap doctors, bogus doctors, to train them, because if there is nothing other possible, we have to train them and bring them in the system so that at least our consumers get some right type of rational treatment than getting something wrong. Whether this is wrong or right, that is a different thing, but this has been happening as a last resort, I guess.
Rajji, you want to add something?
Yeah, it is very difficult to, so maybe some restrictive practices. Jhola Chhap, if they are having certain traditional knowledge down the line, maybe they can continue that, but not step into doing allopathic practice and injections and steroids and antibiotics. And that can be dangerous.
Dr. Rai, I was coming to you.
Bijon, Mr. Bijon,
just a minute. Hold your horses. Your turn will come. I want to go to Dr. Rai. Dr. Rai, आपने बड़े गौर से सुन रहे हैं और इंडियन मेडिकल एसोसिएशन ने इसको लेकर काफी काम किया है, जिसको how to strengthen the so-called quackery in the country, or how to strengthen the people who are playing with the health and safety of the consumers. But at the same time, accessibility is not there. How do you ensure that the doctor is there at the remotest location, where we don't need to depend on such untrained, unqualified people? How do you react to that? Dr. Rai, Indian Medical Association, former Secretary General, Vagera, I do not know what all designations he has got, but he is very active and being a very pro-patient doctor.
Thank you very much, Bijonji. First of all, I would like to give compliments to the organizers, particularly to you and Prafull Bhai also. They have taken a very, very good topic today. And every time we have concentrated more on the patient and the consumer, and it should be done, because our aim is to benefit the society. Now, one gentleman has raised the question of, because there are a lot of things I can share with you, but only 2-3 things because of the...
Yeah, we have got short of time.
First of all,
Dhananjay ji is waiting. I want to hear Dhananjay ji.
As a medical activist and from Indian Medical Association, we are fighting with the government for last more than 3 decades about the quackery and particularly about the Jhola Chhap doctors. They are the menace of the society. They are killing the patients and they are blaming. And you know how the media reports comes in the print media or in the media that doctor has killed this patient due to the negligence of the doctor. And when they investigate, he was the Jhola Chhap doctor. But the whole community is being targeted, which is very bad. Second thing comes implementation. Because time is considered. Implementation, I'm ready in front of all gentlemen, August body sitting here. Implementation of the law is not at all there. Drug as Cosmetic Act is there. Who is following? I want to ask experts over here. Drug and Magic Remedies Act is there. Nobody can give false advertisement in the paper or in the media to misguide the public. But every day on the paper, you just see, even on the electronic media, lot of advertisement is coming. But who is checking? We have written to the PTI, we have written to the ANI, we have written to the press club also. No action has been taken. Now, without any medicine introduced in the market has to go in the stages.
What is the solution? Come to the solution. Dr. Saab, come to the solution.
Solution is only thing, implementation has to be done properly.
Okay.
As far as spurious...
We'll talk about that.
Two things more. Two things only. Spurious medicine, today also, those medicines which have been banned in the country are available in the Bhagirath Palace. You come with me and I will give you one thing. As far as the quality of the medicine is concerned, drug controller, I had attended meeting in 2012 when I raised the question with the drug controller, because sir, you are responsible to check the spurious medicine. Then the reply was, I don't have that much persons with me, short of the fund. Sir, don't tell me like this. If you don't have the funds, if you don't have the power, you mean that I will have the power. I mean, this is the topic we can speak hours together.
Yes.
Really, we want solution.
I know.
Committed, we want solution only. Thank you very much.
I know. Rajji, you are putting something on the, can you speak up? Let everybody who are not going to the chat box know what you are trying to say. Rajji?
Yeah, that was a question which was asked by somebody, whether you can put stickers on the label, whether law weights and measure permits that. I would say that weights and measure may not permit, and FDA also does not permit defacing of the label. But if somebody is putting useful, good information for the benefit of the patient on the label and not defacing anything valuable beneath it, I feel morally at least that is a good thing to do.
Very good. Gunjan ji, the turn is yours. Please आइए, अपना वीडियो ऑन कीजिए.
Yes.
लोगों को अपना शक्ल भी दिखाइए ताकि पता लगे कि कोई एक लेजिटिमेट आदमी है जो क्वेश्चन पूछ रहा है. गुंजन जी, प्लीज आइए.
Yes. Can you hear me?
Yes, we can hear you. Go ahead.
हाँ, मेरा सवाल है जेनरिक मेडिसिन से रिलेटेड, जो कि आजकल देश में काफी प्रमोट की जा रही है. सरकार की तरफ से भी प्रमोट किया जा रहा है, लेकिन उसमें एक कुछ ड्रॉबैक जो मैंने देखा वो ये है कि जैसे मान लीजिए कोई दवा 50 रुपए MRP उस पर लिखा हुआ है, वो जेनेरिक है, वो केमिस्ट को 5 रुपए में वो खरीद के ला रहा है और उसको 10 रुपए में बेचना चाहिए, तब भी उसको 100% मार्जिन मिल रहा है. लेकिन वो क्या कर रहा है, बेचते समय उसको 20 रुपया मांग रहा है, 20 रुपया ले रहा है, 50 MRP लगा हुआ है, तो भी वो ग्राहकों को धोखा दे रहा है. तो ये चीजें बंद होनी चाहिए. उसमें MRP जो है वो सही लिखा होना चाहिए जेनरिक मेडिसिन में, ना कि वो एलिवेटेड MRP होना चाहिए. तो इस पर कुछ किया जाना जरूरी है.
ठीक, एक्चुअली आपका सवाल सही है. You have to report this to NPPA. Please report such incidents to NPPA. बगैर सबूत का कुछ नहीं हो सकता है.
लेकिन ये हमें तो पता नहीं लगेगा ना कि उसका असली MRP कितना है. उसमें तो
आपको उससे क्या मतलब है असली MRP? आपको मतलब होना चाहिए कि हमको सही कीमत में मिलना चाहिए. और वो कीमत, यदि आप सोच रहे हो कि वो 50 रुपया लिखा हुआ है, 20 रुपए में बेच रहा है, उसका आकर्षित कीजिए, उसका ध्यान लाइए NPPA को, जिनके पास मैंडेट है कानूनी, वो इन्वेस्टिगेशन करके उसमें स्टडी कर सकते हैं. तो NPPA के पास जाइए, वो करेगा. उनके वेबसाइट में जाइए, वहां अपना प्रश्न डालिए और आपको उसका जवाब मिलेगा. आप जब तक नहीं जगाएंगे रेगुलेटर्स को, रेगुलेटर्स नहीं जगेंगे, ये समझ लीजिए बात. और यदि आप लोग सब बोल रहे हो कानून सही होना चाहिए, कानून इंप्लीमेंट होना चाहिए, लोगों से आवाज आनी चाहिए, तब कानून सही होगा. आप लोग आवाज नहीं देते हो, खाली डिस्कशन करने से नहीं होता है. हम लोग, आपको मालूम है, हम लोग हजारों रुपया खर्चा करके पब्लिक इंटरेस्ट लिटिगेशन भी किए हैं, जहां सरकार को बाध्य किए हैं वो कानून को इंप्लीमेंट करें, और इंप्लीमेंट हुआ. लेकिन उसके लिए धीरज रखना पड़ता है, काफी मेहनत पड़ता है, काफी महंगा पड़ता है, क्योंकि कोई भी वकील मुफ्त में नहीं काम करता है. कुछ वकील हैं जो कम पैसे में काम करते हैं, हम लोग उनके साथ जुड़ते हैं और इस बात को आगे ले जाते हैं. तो आप लोगों को भी जुड़ना चाहिए. हमारे देश में आम उपभोक्ता जुड़ते नहीं है. वो 1 रुपया नहीं देना चाहते हैं, लेकिन 10 रुपया का फायदा खोजते हैं. अरे आप 10 रुपया का फायदा खोजने के लिए पहले 1 रुपया तो लगाइए. आप 1 रुपया नहीं लगाओगे, आप 10 रुपया का फायदा खोजोगे तो कहां से मिलेगा? नहीं मिलेगा, वो कभी भी उपलब्ध नहीं होगा. तो आप प्लीज ये कोशिश कीजिए कि जितना आप साधन जुटाकर जो काम सही रूप से एफिशिएंटली कर सकते हैं, जो 40 साल से हम लोग कर रहे हैं, अभी भी हम लोग नहीं पहुंचे हैं उस जगह पे जहां हमको पहुंचना चाहिए. हम ये कहना चाहेंगे कि विदाउट वेस्टिंग एनी मोर टाइम, वी हैव रन आउट ऑफ टाइम. सुरेश जी, आई कैन सी योर हैंड अगेन कमिंग अप. प्लीज मेक इट शॉर्ट and brief. Suresh ji.
Yes, I have action this question for all of you, and especially for me also, because of this just a question of generic medicine. Whether a pharmacist is allowed to substitute the medicine by law, And secondly, if something happened, if the product is substituted for a brand name and something happens to the patient, who will be prosecuted?
So, Manjiri ji or Rajji, you all want to answer? Brijesh ji, you want to answer because you have been quietly listening. I am observing. Brijesh ji, you please आइए because you are one of the founders of this movement in terms of good pharmacy practices. Brijesh ji, please आइए. Anil Johri ji को हम last मौका देंगे as usual. You know, in terms of a question which I have got and an answer also, I would like to provoke people to agree to. So, Brajesh ji, you want to answer that question of Suresh ji, what he is saying, or anybody, Manjiri ji or Raj ji, please come forward.
Is Brajesh ji here or has he? I think.
Yeah, please go ahead, Manjiri ji.
As per the law, brand substitution is not yet allowed by the Act. So if the brand A is written, I cannot give brand B as per the law. But what is happening in the actual practice in even in Janaushadhi or similar shops, that the brand substitution is happening. So in many government sector shops also, this is happening. So it is like kind of a feeling that yes, it is allowed now. But the Act says that the brand substitution is not to be done if you do the right interpretation of the Act and the rules. Yes.
Very good, very good. Mr. Dr. Ramana, you wanted to say something.
Yeah, same thing. I just support the not to encourage the quackery. That is the thing. In the interest of the patient safety. That's what the doctor has told already.
Very good. Okay. Now, if nobody has got any more questions, and if there are no hands raised, I would like to conclude by summing up in terms of what I could hear from all my eminent participants. You see, Rajji and Manjiri ji, you all are open to come back and answer my question, which I'm saying. The first thing is, can we recognize the good practitioners in our country? People who are good and who are actually practicing good pharmacy practices. Let's recognize them.
Yes, we can.
And Consumer Online Foundation, Aware Consumer, Positive Media, Parivar, we will all come together to recognize them. Please make a list of all such practitioners in the country, statewise, and let us recognize them in a grand event, either in Mumbai or in Delhi or in Bangalore, wherever we feel we will have the maximum participation, and let's make a big show out of that in showcasing the people who are not only practicing the law, but doing more than the law. So we would like to recognize them in the country, release their list on that day of those practitioners. And as Anil Johri ji is there, we would engage with him in terms of figuring it out, how we will give an accreditation or how we will find a method to that initiative which we want to do and launch, and not depend only on the government and the regulatory authorities to implement the law, but at least recognize those people who are doing more than the law. And how we can do that, showcase some of these reports, like what Dr. Narayan said, you know, the study which you conducted, or any kind of a published paper, a scientific paper which is there, which is showcasing the dangers the consumers are facing because of no implementation of the law in an efficient manner by the state regulators. So let's agree on doing an event in 2024. Decide on the date. I leave it to Manjiri ji and Raj ji, Prafull ji to decide. Prafull ji is our vice chairman. He has all the access to the resources which we have got. He is privy to all our strengths and weaknesses and challenges. So he will coordinate with you all to recognize. And we want to do an event where we want to showcase the champions in this business so that the neighborhood understands, consumers understand that if you want fair dispensation of medicines, then you can blindfoldedly go to these shops and get them out and encourage more and more convert people, more and more people to get converted, to come into the mainstream and not depend on the regulators to tell us who is right and who is wrong, but depend on the consumers to decide who is right and who is wrong, so that we can check. We can be the arms of the regulators. And as you know, in all our laws, the consumers have been given the power to be part of the regulatory mechanism. They have the right to go and also draw samples. They have got the right to speak up wherever any unfair practices are happening. So my contention is, let's join hands. Let's do it together. Let's encourage those good Samaritans, good champions, which Rajji today made us privy to. Rajji showed us certain slides of those champions. Can we identify them in the country and take a guarantee? आज हमारे देश में गारंटी का जमाना आ गया है. हमारे प्रधानमंत्री गारंटी दे रहे हैं. हम लोगों को भी गारंटी देना है as consumers. We have to give a guarantee to the consumers that we take the guarantee that if you visit these shops, like what Raj mentioned, you will get fair and correct dispensation of the medicines and healthcare from those shops. Let us start a movement in that direction. That is my suggestion. I would like to hear from Manjiri ji, Raj ji on this proposal, which has been working in my mind since the time we started this conversation today, and listening to both of you who actually provoked me to come out with this proposal, because that will bring solutions to many issues which we discussed today. So the mic is yours, Manjiri ji and Raj ji, we want to hear from you.
Yeah. So I profusely thank you for this proposal, and you had said it before also. Thank you so much for this idea of identifying the good pharmacists across the country and showcasing their work. We have tried a little bit few years ago on the World Pharmacist Day through a good pharmacy practices competition, but now we can make it a bigger thing and we can publicize it much more. And through this, we can definitely identify. We can also take IPS Students Forum on board, and we can do this in a very grand way. And I think putting the pharmacist work as an evidence in front of policymakers up to consumers is very important. So thank you, sir, for coming up with this thought. We will do
Rajji.
Yes. Yes, I agree very much with it. We'll do that, sir.
Very good. So, Prafull bhai, you've got some work on your plate, as usual.
Yes.
You know, I don't.
I like this kind of work, as you know. It's my profession.
I don't allow people to go to sleep, and that is why my tagline is Jago Grahak Jago. And I like to keep the Grahak always awake to move forward without wasting any more time. You know, Uday Manna ji has been impatiently waiting for his turn. But before that, Anil Johri ji, your final word. I always give you the final word. Anil Johri ji. Are you there or you have left us? Unmute and come.
He's there.
No, he's there. I can't see him, because that's why I say put on your video, then only I believe.
He's muted. He's muted also.
He's muted and he might have gone to the washroom, I think. Maybe. I don't know where he has gone. But Uday Manna ji, please.
फार्मेसी प्रैक्टिसेस को लेकर जिस तरह से चर्चा हुई है और आपने इसको काम को आगे बढ़ाया है, निश्चित रूप से पॉजिटिव मीडिया का भी ये रोल रहेगा कि आप लोग जो चीज आइडेंटिफाई करें जहां भी जिस क्षेत्र में पूरे भारत में, उन लोगों के बारे में पॉजिटिव मीडिया जो है वो लोगों को बताए, तो उसे लेकर हम लोग भी काम करें.
Very good. Very good. Very good. I know I have a few locations to suggest. You all can think about it. One location is Jamshedpur, from where I started the movement in 1983. We can have that grand event there. That is one location, you know, which rarely people go there because it is not very well connected by air. You have to go by train. So it will give you an idea about Vande Mataram and, you know, all the new kind of trains connections which are coming in the country, how good they are. So you will get an experience of that. And of course, you will also get the experience of what Nitin Gadkari is doing in terms of highways because you can drive down from Ranchi to Jamshedpur, which is now very well connected because of Gadkari ji. He has made fantastic highways in the country and super highways. So having said that, that is one location. Second location, we have been thinking of doing something in Pondicherry for a long time, because the women folks in Pondicherry, led by Beena ji, AIWC is very active there. We want to do something either in Pondicherry or, as you all would feel, in places in Uttar Pradesh. Like Gorakhpur is one place where I have recently got inducted in a university as a visiting professor. So I am attached to 4 academic institutions: Banaras Hindu University, Gorakhnath University in Gorakhpur. I am also attached to, National Law University of Odisha, so we can do in Odisha also. I am advisor to Government of Odisha, so we can do in Odisha. So think on these locations I am suggesting to the group, and I would recommend that Prafull Bhai may be nominated to chair this group to develop the plan of action for this mega event, to recognize the good pharmacy practitioners in the country and release a registry of all pharmacists who are today taken as a guarantee by some of us that they will not adopt any unfair practice, and we will release that registry of the country in statewise, and we will acknowledge them, and then the list can keep growing. After the release of the first list, we can keep it growing. So as everybody agrees, Prafull Bhai will chair that committee to organize this, and we would do it in 2024, preferably before the general election is announced, so that it becomes part of our manifesto. And as you know, Prafull Bhai, we are already thinking of developing a consumer manifesto for the general elections, which are due in 2024. So this should become a part of our manifesto as a demand from the consumers to ensure that there is no compromise on the health and safety of the consumers in terms of good pharmacy practices. So having said that, I now quickly want to go to our none other but a smiling, Beena ji, who is a great kind of a provider of leadership of the women empowerment. Beena ji, अब आप अपना प्रश्न भी पूछिए, आप जो करना चाहिए कीजिए, लेकिन हंसते रहिए, मुस्कुराते रहिए. माइक आपके लिए है. सबसे विदाई लेना चाहते हैं. Thank you very much for giving me this opportunity to moderate this conversation. So, Beena ji, mic is yours, and of course, the last word will come from Uday Manna ji before we wind up. So, Beena ji, the vote of thanks.
Thank you very much, Bijon ji. पहले मैं वोट ऑफ थैंक्स क्या देना, इतना बढ़िया हमारे एमिनेंट स्पीकर्स, बोथ द स्पीकर्स, दे गिव अस सो मेनी पॉइंट्स एंड सो मेनी इश्यूज फॉर दिस. क्योंकि ये मेरे पहले मैं आप ही का थैंक्स कर दूं, क्योंकि आपने इस इशू को लिया है. मैंने तो ऐसे ही कहा क्योंकि मैं समझती हूँ कि मैं फील्ड वर्कर हूँ एंड आई वर्क विद कम्युनिटी. सो आई फील दैट दिस इज अ मेजर प्रॉब्लम इन आवर सोसाइटी, मेडिसिन. एंड बहुत सारे इश्यूज हैं जो कि हमें शायद अब टाइम का आपका कंस्ट्रेंट रहता है कि इसमें बहुत से डॉक्टर्स ऐसा प्रिस्क्रिप्शन लिखते हैं कि जो उनको समझ में नहीं आता, और जब वहां पे फार्मासिस्ट नहीं है तो वो ब्लड प्रेशर की दवाई वो बुखार की दे देते हैं, बुखार की दवाई ब्लड प्रेशर की देते हैं. सो पीपल आर फेसिंग लॉट ऑफ प्रॉब्लम. दिस इज अ वेरी मेजर इशू इन आवर कंट्री. और हमें ये सोचना चाहिए कि हाउ मेनी पीपल आर अनएजुकेटेड इन दिस कंट्री. दे आर मेजॉरिटी. सो हमें उस तबके को भी अगर हम पकड़ के चलें तो ये बहुत ही, पता नहीं, मैं उस फील्ड में काम करती हूँ इसलिए मुझे बहुत टच करता है कि हमें उनकी हेल्प करनी चाहिए. आज के जो हमारे दोनों ही एमिनेंट स्पीकर हैं, मिस्टर राज जी एंड मंजरी जी, आपने बहुत ही अच्छी तरीके से एक्सप्लेन किया है. मगर राज जी से तो मैंने क्वेश्चन कर लिया कि आपका अगर गवर्नमेंट इम्प्लीमेंट नहीं हो रहा है और उनके रूल्स हैं, लॉ है, तो उसका हम कैसे करें. मगर ये हमारे लिए बहुत जरूरी है. लॉ बनवाना या बनाना इज नॉट इम्पोर्टेंट, उसको इम्प्लीमेंट पूरी तरीके से करना इज वेरी इम्पोर्टेंट. एक छोटी सी चीज अगर हम सही करते हैं तो वो बहुत अच्छी, उसकी रिजल्ट अच्छे आते हैं. और अगर हम फैलते जाते हैं और उसके रिजल्ट्स नहीं आ रहे हैं, देन देयर इज नो पॉइंट. और मंजरी जी, जो आपने कहा कि फार्मासिस्ट पैसे दे करके सर्टिफिकेट ले लेते हैं, आई थिंक दिस इज अ मेजर क्राइम। इसको, इन इश्यूज को हमको टेक अप करना चाहिए कि क्योंकि इस तरीके से ये हो रहा है। और बहुत ही क्लियरली आप लोगों ने जो बात कही है वो बहुत अच्छी लगी, क्योंकि ये हमें लोगों तक पहुंचानी चाहिए। और इसका उदय मन्ना जी इज द मेजर सोर्स, and otherwise also we'll try to aware people in this field, because this is a major field. Our eminent Mr. Seth, PD Seth, जो कि इस फील्ड में बहुत ही माहिर हैं, और सुबेरे को उनका अगर व्हाट्सएप खोल करके देखो तो एकदम से उनकी कुछ ना कुछ एक ऐसा आएगा कि जो पढ़ करके अच्छा लगता है। कभी हॉस्पिटल्स के बारे में, कभी डॉक्टर्स, फॉल्स डॉक्टर्स के बारे में, कभी किसी चीज के बारे में। ही सो अवेयर एंड ही इज गिविंग अस दिस इंफॉर्मेशन एवरी डे इन द मॉर्निंग, एंड आई एम वेरी ग्रेटफुल एंड थैंक्स बोथ द स्पीकर्स एंड द मिस्टर सेठ कि जो हमारे से जुड़े हुए हैं और बहुत ही हमें अवेयर करते हैं टाइम टू टाइम। इसमें मिस्टर बिजॉन जी का भी मैं बहुत धन्यवाद करना चाहूंगी कि जो ऐसे ऐसे इश्यूज ले लेते हैं और पहुंचाते हैं। और हमें मैंने एक छोटा सी बात कही थी, 2-4 सैंपल बताए थे उनको, उन्होंने इसको टेकअप किया और इस मैगजीन को इतना बढ़िया लिखा है, इतना बढ़िया पायल जी ने तैयार किया है कि वास्तव में जब लोग पढ़ते हैं तो बहुत उनको मन करता है कि वो पढ़ें। आप लोगों के एक चीज पर्सनल भी बताऊंगी। मैंने ये मैगजीन अपने ग्रैंडसन को दिखाई, who came from US, and he read few pages and he said it's a very good work you have been doing and आप लोगों को ये काम करना चाहिए। He liked that magazine very much. And बिजॉन जी के बारे में मैंने उनको बताया कि ये हम लोगों से कैसे काम कराते हैं और अब कैसे हम काम करते हैं। तो ये एक इनकी क्वालिटी है। ही गिव्स लॉट ऑफ रिस्पेक्ट एंड पिक अप द इश्यूज जो हमारी सोसाइटी के लिए बहुत जरूरी है। एंड ही इज वेरी मच कंसर्न फॉर द पीपल्स हेल्थ, एंड ये दिस इज नॉट ऑन पेपर। आई थिंक उनकी बहुत डीप इन हिज आर्ट, वो हमेशा इस बात पे के इश्यूज को लेकर के आते हैं। और जो हमारे पार्टिसिपेट किया है, मगर हमारे रमैया साहब ने जो कितनी खूबसूरत बात कही है कि ये बड़ा नोबल प्रोफेशन, इसको हमें इस तरीके से नहीं करना चाहिए। मगर आजकल शायद लोगों की जो एक अंदर वो होती फीलिंग हो गई थी, वो बिल्कुल खत्म हो गई है। और हमारे जितने भी एमिनेंट पार्टिसिपेंट्स हैं, जिनके एक एक वर्ड, क्योंकि टाइम बहुत कम है इसलिए मैं एक एक का नाम नहीं ले सकती, उनके लिए मैं बहुत धन्यवाद करती हूँ कि आपके पॉइंट्स मन्ना साहब ने सब कवर कर लिए हैं, जो आप दोबारा सुन सकते हैं और बहुत ही अच्छी तरीके से इस पे हम लोग सब इम्प्लीमेंट भी कर सकते हैं। श्री उदय मन्ना जी को मैं धन्यवाद देना चाहती हूँ कि जो इतनी अच्छी तरीके से ये प्लेटफॉर्म से हम लोगों तक पहुंच पाते हैं, और उनकी जो टेक्निकल टीम है उसको भी मैं धन्यवाद देती हूँ, क्योंकि वो इतनी अच्छी तरीके से कवर करती है कि देयर इज नो डिस्टरबेंस इन बिटवीन। एंड हम लोग लेट भी कभी कभी उनको कर देते हैं, तो वो उनमें बहुत पेशेंस है। तो सबका मेरी तरफ से बहुत बहुत धन्यवाद। एंड अगर कोई रह गया है तो उसके लिए भी मैं माफी चाहूंगी, मगर सबका मैं बहुत धन्यवाद करती हूँ। आज के प्रोग्राम वाज एक्सीलेंट प्रोग्राम, एंड बहुत धन्यवाद आप लोगों का सब। थैंक यू वेरी मच।
उदय मन्ना जी।
जी, जय हिंद सर।
जय हिंद। यू मे कंक्लूड द सेशन।
जी, बिग थैंक्स सभी लोगों को, क्योंकि सकारात्मक सोच जो है वो सफलता दिलाती है, और इसीलिए मैगजीन की सफलता की चर्चा हो रही है कि फार्मेसी प्रैक्टिसेस पे द अवेयर कंज्यूमर ने इतना अच्छा अंक निकाला है, और इस पर आरजेएस पीबीएच का ये वेबिनार हो रहा है। ये 2047 तक का जो अभियान है उसके लिए हम लोगों को बहुत सारे लोगों को जोड़ना पड़ेगा, और प्रफुल्ल भाई ने आज का कार्यक्रम स्पॉन्सर किया। इतने लोगों को इकट्ठा करना, बातें करना काफी समय लग जाता है। टेक्निकल टीम का भी धन्यवाद कि वो अच्छे तरीके से जो है वो इन बातों को सोने पे सुहागा का काम करते हैं। आप कांटेक्ट भी कर सकते हैं, जिससे कि हम लोग इस परिवार को और ज्यादा आगे वर्ल्ड वाइड, बिजोन मिश्रा जी कहते हैं वर्ल्ड वाइड करना। तो रमैया साहब का भी बिग बिग थैंक्स कि वो इंटरनेशनल दर्जा दिलाते हैं, जुड़ते हैं और उनका नाम रजिस्टर्ड कर लिया गया है। अब इस कार्यक्रम का समापन इस बात से कि ये बिगिनिंग होता है, हर कार्यक्रम की अंत जो है वो किसी नई चीज से शुरुआत होती है, क्योंकि हम लोग सकारात्मक हैं, सकारात्मक ऊर्जा से भरे हुए हैं। तो 17 आज का दिन विश्व मानव अधिकार दिवस पर हम लोगों ने अडॉप्ट कर लिया कि गीता पाठ से कार्यक्रम की शुरुआत होगी, और 17 दिसंबर जो है वो एक माइलस्टोन बनने जा रहा है, क्योंकि बिहार की संकल्प यात्रा शुरू हो रही है 10 दिनों की। उसके अंतर्गत जहां जहां पे मैं बताना चाहूंगा, पटना यूनिवर्सिटी के वाइस चांसलर के साथ बैठक होगी, आर्यभट्ट यूनिवर्सिटी के रजिस्ट्रार के साथ बैठक होगी, जो ऑलरेडी पहले भी वो जुड़े हुए हैं, और एमएसएमई मंत्रालय भारत सरकार के डायरेक्टर के साथ जो है ये मीटिंग तय हो गई है। और बिहार हिंदी साहित्य सम्मेलन, जिसके कि पहले अध्यक्ष जो है वो डॉक्टर राजेंद्र प्रसाद, भारत के प्रथम राष्ट्रपति थे, आज डॉक्टर अनिल सुलभ जी हैं, उनके साथ भी बैठक होगी। और मसौढ़ी और भोजपुर जिला के गांवों में भी हम लोग जाएंगे, तो और एक रजिस्टर लेकर जाएंगे इस बार। यही प्रोफेसर बिजन कुमार मिश्रा जी, आपने जैसे कहा कि जन जन तक ये सकारात्मक आंदोलन पहुंचना चाहिए, तो इस बार पहली बार हम लोग संकल्प यात्रा लेकर लोगों से संकल्प कराएंगे, उनसे चर्चा करेंगे और उनका नाम नंबर जो है नोट करेंगे, उन सभी लोगों का, ताकि हम लोगों के पास ये रहे कि हम लोग किन किन लोगों को पॉजिटिव आंदोलन के बारे में बताएं। बहुत सारी वीडियोस, हर दिन की रिपोर्ट, 10 दिनों की 10 रिपोर्ट जो है आप लोगों को आरजेएस पॉजिटिव मीडिया, ये आरजेएस पॉजिटिव मीडिया पे ये आप लाइव सारी रिकॉर्डिंग सुन सकते हैं। टेक्निकल टीम का भी धन्यवाद कि बहुत प्रॉपर तरीके से वो इसको हैंडल कर रहे हैं, और हम लोग 2047 तक के लिए प्रण किए हैं। तो आप लोग निश्चित रूप से उस दिशा में अपने अपने क्षेत्रों में काम करना शुरू कीजिए। एक महत्वपूर्ण घटना होगी कि सुरजीत सिंह दीदेवार जी का हर महीने कार्यक्रम होता है, तो इस बार जो है परिवार पर, फैमिली पर जो है वो आ रहे हैं। मानव समाज द्वारा निर्मित परिवार, फैमिली क्रिएटेड बाय ह्यूमन सोसाइटी। तो ये जो है हम लोग 17 दिसंबर को सुबह 11 बजे से करेंगे, और उसमें स्वतंत्रता सेनानियों को भी श्रद्धांजलि देंगे। नरसिंह मेहता जी, जिन्होंने कि वैष्णव जनते ने कहिए लिखा था, गांधी जी का प्रिय भजन, और काकोरी कांड जो हुआ था उसमें जो हमारे स्वतंत्रता सेनानी शहीद हुए थे, उनको फांसी दी गई थी, उनको और राजेंद्र लाहिड़ी जी को, इनको श्रद्धांजलि देंगे हम लोग। और ह्यूमन सॉलिडेरिटी डे है यूनाइटेड नेशंस का, उसको भी सेलिब्रेट करेंगे हम लोग। तो इसी के साथ आप सभी लोगों का तहे दिल से हार्दिक धन्यवाद। ये कार्यक्रम जो प्रफुल्ल भाई ने अरेंज किया, निश्चित रूप से बहुत बड़े बधाई के पात्र हैं। इस तरह से ये जो इतिहास बन रहा है, जो लाइब्रेरी बन रही है, ये हमारे आने वाली पीढ़ियों के लिए रहेगी। और किताब जो आ रही है, जो जनवरी में 21 जनवरी को ये दिल्ली में उसका पोस्टर का लोकार्पण होगा, और 13 फरवरी को अंतर्राष्ट्रीय ग्लोबल जर्नलिज्म फेस्टिवल, अंतर्राष्ट्रीय फेस्टिवल में उस किताब का लोकार्पण होगा, और कलर्ड पुस्तक आएगी। इन्हीं सब कार्यक्रमों पे आधारित रहेगी, इन्हीं यात्राओं पे रहेगी। तो आपकी किताब आपके लिए, आपके द्वारा तैयार हो रही है, भूलिए नहीं। और याद रखिए 17 दिसंबर सुबह 11 बजे। जय हिंद, जय भारत।
थैंक यू।
सकारात्मक सोच को आओ सारे भारत में फैलाए, सकारात्मक ऊर्जा का आओ सब में संचार कराए। ऐसा ना हो कि हम अपनी जिम्मेदारी भूल न जाए, क्यों इंतजार करें हम किसी का, आओ एक मशाल जलाए। सकारात्मकता के उदय का चलिए हम उद्घोष कराए। आरजेएस जय हिंद के नारों से अपना देश जगाए, आरजेएस वंदे मातरम से सारी सरकार जगाए।